Ganglion cysts are benign tumor masses. They are a type of mucinous-filled cyst found adjacent to joint capsules or tendon sheaths. They will consist of an outer fibrous coat and an inner synovial lining and contain a clear, colorless, gelatinous fluid. Typically, they are found on the dorsal wrist, and they usually occur singly, but they may also be multiocular, meaning that there will be multiple in one area. 70% occur between the second and fourth decades of life. These cysts are insidious and spontaneously appear, but they seldom cause any pain or loss of motion. Ganglion cysts are most frequently found in the hand and wrist. Approximately 65% are on the dorsal side, primarily over the scapholunate ligament. 20% are on the volar side, and they are primarily at the volar wrist crease between the flexor carpi radialis and the abductor pollicis longus at the scaphotrapezoid joint. As mentioned before, they are a localized mass. If there is pain, it's going to be site-specific. The cyst is firm, smooth, rubbery, rounded, slightly flatulent, and tends to be point tender. However, they are usually fixed. They may be slightly movable if it is actually involved in the tendon sheath itself. The person may complain of pain with wrist extension if it is on the dorsal side and wrist flexion if it's on the volar side. Range of motion will be within normal limits, but there will be pain due to any type of compression of tissues. There really aren't any special tests because upon visual inspection you will be able to see this cyst. However, you may have the person perform wrist extension or flexion to look for compression of tissues. Diagnosis is clinical. Treatment is interesting. You have probably heard the old wives' tale of taking a big book and just hitting the cyst and that will cause it to explode. Not a good thing to do. Treatment is going to consist of aspiration or perhaps a surgical excision. Do not hit the person with a big book.